of the Budget Review Subcommittee on Economic Development, Public Protection, Tourism, and Energy. Madam Secretary, will you call the roll?
Representative Gooch, Representative King, Representative Lehman, Representative Wesley, Representative Witten, Representative Bowling, Representative Bray, Representative Petrie, Vice Chair McPherson, Chair Fugit.
I'm here. All right. We will not have a quorum to approve the minutes, but at this time, up first is Travers Manley, is that right? With the Kentucky Horse Racing and Gaming Corporation, testify about the problem gaming funding amounts. As you have a seat there, if you'll raise your right hand to be sworn, and then I'll have you to identify yourself. Do you promise to tell the truth, the whole truth, nothing but the truth? All right, if you'll turn your microphones on and introduce yourself, and then proceed with the presentation, please.
Good afternoon, Travers Manley, Senior Vice President of Gaming with the Kentucky Horse Racing and Gaming Corporation.
Good afternoon, Ashley Bailey. I'm the Chief Legal Officer with the Kentucky Horse Racing and Gaming Corporation.
And I am Hannah Sims, the Director for Sports Wagering at the KHRGC. And I will get started here. I think we have, yeah, that's it. We'll pull up our materials. Oh, you can just go to the next slide. So we are here to provide a brief update to sports wagering revenue allocations that we shared with you in August of 24. As you can see on the slide here that Travers has pulled up, fiscal year 24, in just about 10 months of operation. So that was September 7th for retail, the first legal sports wager, and September 28th, I believe, for for the inception of online sports wagering. So just about 10 months of operation in fiscal year 24. Sports wagering revenue deposited $34.84 million in the pension fund and about $931,000 in the problem gaming assistance fund managed by CHFS. That we will hear about a little later in this meeting. Fiscal year 25 to date, that's about 7 months of operation, July 24th through present. We have deposited an additional $18.5 million in the pension fund with another $556,000 to problem gaming. Those bring us to all-time totals of over $53.34 to the pension fund and $1.48 million to the problem gaming assistance fund.
Okay, thank you. What's the total that's been spent in sports wagering in Kentucky in that 10 month? Do you know?
As far as total wagered,
Mm-hmm.
yes, we have those numbers with us. Do you have that handle?
Total amount wagered from in September of 23 through December of 2024, $3.5 billion with $3.39 billion online, $125 million retail. Fiscal year 25 to date, $1.4 billion in overall wagers. So that would be from
3.5 billion with a B.
Yes.
In 1 year.
That would be the 3.5 billion is from September through December,
Right.
So it's a little bit over a
Right,
year.
and then 1 point what this year?
It's 1.4 billion total wagered fiscal year 2025.
So what percentage of that that goes into the problem gaming fund?
2.5.
2.5%.
Yes.
And it's 2.5% of the revenue.
Right.
So
So the total revenue that comes to the state, then the 2.5%
Correct.
comes out of that.
Yes.
Whatever. So go ahead.
The revenue from that the operators and the providers are receiving. So
Okay.
the amount wagered And then the tax is on the gross gaming revenue or adjusted gross revenue, which is subtracting out winnings and the federal excise tax.
Right. Okay.
So the fiscal year adjusted gross revenue, it's $1.4 billion wagered. The adjusted gross revenue is $136.5 million.
Okay. All right. So you don't. The only thing that you do is you keep track of the money that goes to CHFS. You don't keep up with the number of people that actually call in needing help with the gaming. Is that right?
That's right. The problem gaming helpline is managed through CHFS. What we do through the Kentucky Horse Racing and Gaming Corporation related to responsible gaming and problem gaming would be the management of the self-exclusion list that is run through or is collected through our service providers and our operators in sports wagering and pari-mutuel wagering.
Okay. And do they? So they don't. You basically you give them the money, but they don't report back to you of anything of how much money they've spent.
No.
Okay, so
The
you don't
only
know.
report we would see would be the annual report that was required by the legislation. I think it's an October report, annual report that CHFS is legislated to do annually, and that's October. I think we got the first one this October, but that's the only knowledge we have of the use of the funds.
Okay, does the 2025 numbers show? Does that include the Super Bowl?
They would not yet. No, those report. We report about the service providers file taxes monthly, so they've not filed for the period that would include the Super Bowl yet. But we should be getting those shortly, and we do post a monthly update on the website. Would be happy to share that with the committee if you'd like that.
Okay, for the members that just came in, we're dealing with the problem gaming fund. With the pari-mutuel wagering, sports betting, and over from September of 23 to September 24, there was $3.5 billion wagered, and then so far this year, there's from September, I guess, of 24 to present,
Yes.
is 1.4 billion. And you have slides in or a sheet in your packet. $931,000 has went to the Problem Gaming Assistance Fund in 24, and then $556,000 fiscal year 25 to date, and that's the gist or the extent of the, I guess, report. Is there any other questions by any other members of the committee that you'd like to ask? We have CHFS coming next to show basically how many people have, I guess, applied for or called in needing help and how much money they've spent. But does anybody have any questions for these presenters? All right, seeing no questions, we thank you for coming in today.
Thank you for your time.
Still don't have a quorum, do we?
Mr. Chair, while our presenters are changing, I just wanted to give our apologies for being tardy. We were in another committee where we needed to register votes.
I understand. Thank you. All right, next up we have Patty Clark from the Division of Mental Health. If you would be seated, raise your right hand to be sworn. Do you swear or affirm to that your testimony you're about to give be the truth, the whole truth, nothing but the truth? If you would turn on the microphones, introduce yourself, and then proceed with your presentation, please.
All right, so I'm going to dig into the problem gaming account, the assistance account, a little deeper.
Okay,
and
could you all introduce yourself?
Oh,
for the
I'm
record,
so
please?
sorry. I'm Patty Clark. I'm the director for the Division of Mental Health within the Department for Behavioral Health, Developmental, and Intellectual Disabilities.
Okay, thank you.
And I am Sarah Cooper. I am the legislative liaison for the department.
Thank you all for being here today.
Yes, and Emily
proceed.
Flath was not able to make it out because she got snowed in. So she was
I
going to
understand
join
that.
us. So good afternoon, and thank you for the opportunity to update you on the Problem Gaming Education Assistance Account. As you know, gambling has long been woven into the culture of Kentucky from our longstanding horse racing tradition And the legislation actually paved the way for both the in-person and the online sports wagering. And so I think it's really interesting that at family gatherings, for example, I often see young men placing bets on their phones, or, my sons-in-laws, while we're watching a game as a group. And so it's just seeing that incorporated into the family life as it has been interesting as we've moved forward. So if you can switch. So the Problem Gambling Assistance Fund, it was an effort to address the consequences that individuals may experience as a result of their engagement in online sports wagering. And so as was noted earlier, 2.5% of the monies received from all sports wagering is included in this fund, and that does include the initial as well as the ongoing licensing fees. Those funds support agencies, organizations, and individuals who are providing education, assistance, and counseling for those affected by addiction to alcohol, drugs, or gambling. They're also used to promote public awareness and education on addictions, establish and fund programs for certifying addiction counselors, highlight available assistance programs, and cover costs related to addiction treatment. The fund also allocates $50,000 for administrative expenses, covering a portion of the program administrator's salary to manage this process. Within the last 18 months or so, we've established criteria, funding standards, performance measures, and program monitoring requirements so that we can allocate these funds effectively and ensure they are being used efficiently. We've also developed an application review process, award procedures, and the annual reporting process to the LRC. Let's see. So on the next slide, you can see the timeline, which highlights some key milestones, including we've drafted regulations, conducting landscape analysis with our key partners. We released a notice of funding opportunity in October. We've been reviewing proposals and finalizing contracts, and these allow us to ensure an effective rollout of the program. Our numbers are a little different on the next slide. We're showing about 1.4 million. That was through the end of January. So it may just be a timing difference that we're seeing when we pull up the amounts for this fund. The slides were created several weeks ago. So at this point, we had 1,487,716 million in the Education Assistance Fund. You see the state fiscal year 24 quarter 3 was pretty significant at 634,385. That include the initial licensing fees as well as the initial football season to early basketball season within that first year. Then we had the next quarter that would have reflected the Derby, for example. Then we go into quarter 1 of state fiscal year 25, which was a little smaller revenue number, reflecting a little lower online wagering process. And then you start picking up again as we come into the fall season. All right. So one of the things that we started with was a landscape analysis to begin to understand what the potential was for impact so that we knew how to use these funds effectively. About 55% of adult Kentucky residents actually gamble or have said they gambled in their lifetime. And while we didn't have the exact number of folks who would participate in sports wagering, a pre-legalization survey estimated that about 42% of Kentucky adults were likely to engage in sports wagering. So we knew that the numbers would be significant. And what's really important is that the majority of folks can participate in online wagering without it becoming a problem, just as that's the case with other addiction issues. Most people can be in that space without a problem, but for some people it does become an addiction. And so we're seeing about 165,000, this is an estimate, exhibit problem behaviors, and between 47,000 and 64,000 actually have a gambling disorder, so that if they went to a clinician and went through an assessment, they would be diagnosed with a gambling disorder at that point. So that's roughly the number we're looking at. We We cannot give you more exact at this point. We're working on updating data collection systems to be able to understand how many people are coming into our community mental health centers, for example, seeking services for gambling disorders. So we'll be able to move forward with a closer estimate on that number. We do know that fewer than 10 problem gambling certified clinicians are in place in Kentucky. All of our addiction clinicians can provide services for problem gambling, but we really support the idea of specialized treatment services to ensure that individual achieves recovery from their problem gambling. Among youth, we see about 26% of 12th graders who had reported some gambling in their lifetime, and about 2% of them had said they had financial difficulties as a result. Our research shows that youth who start gambling, just as we know is the case with youth who use alcohol, marijuana, and tobacco early, the earlier you start, the more likely you are to have a disorder. So it's the same kind of brain chemistry that goes into place with disordered gambling as well. Total helpline calls, I know you asked about this question earlier. We have seen an increase from about I don't have that number in front of me, actually. We did reach to about 3,240 in 2024, and that was more than double the previous year. We do know, though, that only about 25% of that increase came from individuals seeking help. The majority were seeking information about online wagering and how to do that. So even though those numbers have been significantly higher, the majority of those calls are not specifically from individuals who want support for their problem disorder, the disordered gambling. We have also set up an email and a web page. Over the last year, we've had 3 requests for resources from an individual via that email. We've also had 11 inquiries about partnerships or funding. Our webpage has had 827 views with 406 active user and an average engagement time of 322 seconds. So that can give you an idea of how many people are engaging with the email and the webpage. I'm going to go to the next page. All right, so as I mentioned earlier, in October, we issued a NOFO to expand the workforce supporting individuals with problem gambling and to increase awareness of the risk factors and warning signs. We did two iterations of that. One was a workforce development and training NOFO, and one was focused on public awareness and education. We've received 5 proposals on the workforce and development and training, and we have awarded 1, we have denied 1, and we have 3 that are in process at this point in time. On the public awareness side, we have received 4 proposals, we've awarded 2, and we have 2 that are pending review at this point. All right. We have additional vendors who have expressed interest, and we do expect more applications in the future. So just to dig into some of those awarded projects, the first was to the Kentucky Council on Problem Gambling, which will expand access to the 2025 conference they hold in March through live streaming and recording options. This will allow us to ensure that the training sessions that are made available through that conference can live on and can be utilized long-term to sustain learning opportunities for treatment providers in that clinical space. In addition, we have 2 public awareness campaigns that have been awarded. The first is with Project Ricochet out of Lexington, and they have been awarded $100,000. The campaign will create educational materials, videos, infographics, and multimedia content to spread awareness in that community. And then the second is with Shawnee Transformation Youth Coalition, and they have received $67,343, and that will focus on educating middle and high school students about the risks of gambling, particularly its connections to mental health, substance use, and impulsivity, while also giving them healthier coping strategies as well. These were selected based on their alignment, their proposal alignment with the identified state needs, as I mentioned, the landscape analysis early on, and then future proposals will align with those as well. We also have a 3-reviewer scoring system, so we evaluate experience, their capacity, their understanding of providing services in this space and their experience in doing so, as well as discussions with the group about how their proposals actually address the gaps that we've identified in the problem gambling landscape. We have refined the NOFO that we sent out in October, and we will reissue again in March to coincide with the council's problem gambling conference, and we'll be seeking additional opportunities to fund the dollars within the assistance fund. We also have developed a problem gambling resource kit, which allows us to raise awareness of problem gambling, and it's a resource kit that folks can utilize in a variety of different locations. We are also partnering with the Kentucky High School Athletic Association as we move into March Madness to highlight the importance of youth not engaging in gaming situations, and just encouraging adults in their life to support them. And so really to talk about the resource kit a little bit, it educates, prevents, and connects, and allows a variety of resources available, and you can access that online at the QR code or at the tinyurl.com website. And then within that kit, we also have a number of additional resources: the National Problem Gambling Helpline, the 1-800-426-2537, which is answered by River Valley Behavioral Health in Owensboro for Kentucky residents. We also have information on Gamblers Anonymous, the Kentucky Council on Problem Gambling, as well as the 988 Suicide and Crisis Lifeline. You can also use the QR code on this slide to access the Problem Gambling Assistant Program website that we have in the cabinet as well. And then Emily Flath is our Problem Gambling Program Administrator, and she is available at this email address to be able to answer any specific questions.
Okay, thank you, ma'am. Representative Whitten.
Thank you. Thank you for the presentation. I had a question, and not sure. Do you get the qualitative information about the individuals that reach out, and do you differentiate between, I guess, their problem gambling, as far as whether it's Churchill Downs or a sports book? Or...
It really depends on what the person provides during that call. Typically, for a helpline call, counselors are advised to let that person provide the information they want to provide, and so unless they provide it, we do not collect it. Any information that's pertinent to supporting them in that process is collected, but we have not received enough information that we can break down if it's coming from online versus Churchill versus Red Mile versus any of the other opportunities at this point.
Just another quick.
Yes, ma'am.
I know last week Churchill Down closed their sports book. Do you see that being? I guess it seems to me like a lot of the gambling is on people's devices and on their phones. Is that does that change the way you all try to reach out, since it seems like people are more individual and on their own, and they're gambling by themselves?
Absolutely. That's why we are working really closely with some of the national subject matter experts to understand how sports wagering and online wagering impacts how usage changes as a result of that fact versus going to a track versus going to a casino, for example. And that's why we're looking at, with each of these projects, we're looking at them using social media, using those typical sites that these individuals might frequent digitally to be able to push out the messages. And so, we're not necessarily dropping a huge statewide campaign that everybody's going to see. We're really targeting those dollars so that they get to the people who are most likely to be impacted as a result of excessive gambling.
Any other questions? Okay, I have just a few questions. What's the process if I had a problem with gambling and I called this helpline? What happens? Tell me the process.
So they will, the crisis counselor will just have a conversation with them. They will develop a rapport so that the person can share enough information that they can identify the correct resources to connect them to. And so depending on their location, they will either connect them with a community mental health center. They will remind them if they already have a therapist or a counselor that they're seeing to make connections back to them. They will connect them with other resources in the community, depending on if their gambling is having an impact on their finances, they're potentially losing their home or things like that. So depending on the needs of the person that calls, they will have that conversation will play out to the point where they understand what resources to connect them with, and then we'll provide that information for that individual to make that connection.
Is it a 24-hour?
Yes.
7-day-a-week
It's
helpline?
24/7, yes.
And how many employees do you have that just are part of this problem gambling program?
I don't have that number off the top of my head. River Valley does have a crisis line that they answer, the problem gambling line, as well as 988 at that location. And they also have their local crisis line. So they staff those as a collective. And they're all of those counselors are trained to answer all of those numbers.
So if somebody in Hazard's got a problem and somebody in Mayfield's got a problem, they call the same number.
Exactly.
And then they put it out to their areas.
Exactly.
And they refer them to, like, it's all outpatient, treatment or, okay.
Yeah, absolutely.
Do you find that there's a combination addiction with gambling and drinking, gambling and drug use? Do you ask that question, or is it just gambling?
They do ask that question, and obviously, as they establish that rapport with that person, they understand the different components that are coming into play in that problem, and we are working with River Valley right now to get that data and have them break that out for us so that we can understand those connections. But the research does show that there is a strong correlation between alcohol use and gambling, mental health and gambling. So those things, they do parallel each other often. And so being able to address both at the same time, that co-occurring disorder is important as we move forward with building our capacity for treatment providers.
Okay. And so this problem gaming fund, you not only do like the treatment for the helpline or the 24-hour line, but do you also do the campaigns
For promotion, right.
out of that same money?
Right. So
Okay.
our focus has really been on building the capacity of treatment providers in the community. As I mentioned, we have fewer than 10 that are specifically certified and trained in problem gambling disorders. And so we want to increase the number of people who understand that problem gambling could be part of what their client is presenting with, and recognize and screen for that as well. And so more about, obviously we can provide individual treatment through these dollars, but the goal is really to make sure that the folks that can treat them have the capacity to treat them effectively, and the resources to do so, and the understanding of the connections that they need to make.
Okay. This may be a difficult question, but do you know how much per person average that it would cost to help one person? You know what I'm saying? Like, if you have 10 people that call in, how much per person, money, dollar-wise, does it take to help one person?
I think it depends on the severity of the problem. I can run some research and find that number for you, but I don't have that in front of me today.
And so the money goes to the crisis centers, basically, and then the outpatient addiction help. It goes to those places. Like, is Kentucky River Community Care one of those places in East Kentucky? And do you give them money to help treat?
So at this point, we're focusing on building capacity of those providers and ensuring that we have folks there. We're not providing direct money to the centers specifically to provide treatment, because often those providers have other other mechanisms to pay for those services, for example, Medicaid or their private insurance. And so at this point, it's really focused on building capacity of the providers to address those specific needs when that client comes in, and promote awareness of the problem gambling issues that may be seen.
Okay, so none of this money actually goes to treating people who have gambling, because if they've got Medicaid, then they turn it on the Medicaid.
Exactly.
So
Now, if
okay, let me ask you this: why would this fund not have to reimburse Medicaid for the cost of the problem that's happening? You understand what I'm saying? So if Medicaid is spending $500,000 to help those who have gambling addictions, why would this fund not have to pay back Medicaid to pay for it? You know, because the state is paying for it. You understand what I'm saying? Okay. One more question, and I'll be finished. Is 2.5% enough?
it's not enough if you want to pay for the individuals.
Okay,
If that's what
and I guess I just misunderstood the entirety of the problem gaming fund. If it's not really going to the people that have gaming problems, then I think if we're taking in this much money as a state, then that fund should have to pay for the problem that we're created. And maybe that's another conversation for another day. But so could you find out how much money
The
is
average
Medicaid paying for counselors and so forth throughout the state? How much money are they paying to help people with a gambling addiction? And just my opinion, and sometimes it don't matter much, but the gambling fund should have to pay that price. So, any other questions? Representative Lehman, is that right?
Lehman, yeah.
Good to have you on the committee.
Yeah. Thank you, Mr. Chairman. Apologies for being late as well.
all right.
So lots of
all right.
conflicts. But thanks for the presentation. I just a few questions, and they're probably somewhat related. I guess one, so the calls you get or the emails you get and you refer those out, do you have any data on the outcomes, like what happens to those? Do you get any follow-up or feedback? Or
Those calls are anonymous,
Okay.
and so there is no ability to track what happens to them after, unless they call back and say, thanks for your help, and we try to capture that qualitative data to be able to report on those outcomes, but it is anonymous.
Okay, and I was so the call center. I'm sure that a lot of these calls are going to be people in an immediate crisis. Are they authorized or equipped to intervene if these
Absolutely.
are like
Absolutely.
call local law enforcement?
Yes.
Or okay, so that they're okay. And do you? I guess it would be interesting, not today, but maybe in subsequent follow-up meeting. I'm maybe along what the chairman was saying. I think it's trying to get to the bottom of how is this helping people directly. I understand the promotional aspect, the messaging, but ultimately we've expanded gambling. We're collecting this tax to fund this, and we want to make sure it's treating patients. And so I don't know what kind of visibility we can get into what's happening on the other side, how many patients. You can refer them for an outpatient visit. Do they actually call that? But do they ever do anything, or do they just,
Right.
do nothing? So
We're in the process of trying to track that.
I know that's a hard question.
It
It's
is a
not
hard question.
Maybe out of the scope of what you're authorized to do. But
No, we also operate 988. We don't operate. We support the implementation but it's the same concept, right? When somebody calls in for help, the goal of that person is to get them to a place of safety, make sure that they're safe at that point, and if not, intervene as appropriate, and then make sure that they are connected to appropriate resources so that they can continue in that safe space as well. And so this fund was developed from my understanding, to build the capacity of those folks who are on the front lines treating folks to be able to ensure that they receive the treatment they need and that they actually have the care and support and are connected. So when we think about these dollars going to that direct person, it's by building the capacity of the folks that they go to when they call those numbers, when they go to that outpatient clinic. You want to make sure that provider is competent and able to support them as they move forward as well.
Thank you.
Okay.
Any other questions? All right, thank you, ladies, for coming today, and we appreciate you coming. We don't have a quorum, so we will not approve the minutes from last meeting, but the next meeting will be next Wednesday, February 26th, and we thank you for coming. Meeting adjourned.